A federal judge in Texas has ordered the banning of the most commonly used abortion pill in America, despite that it has been FDA approved for 23 years. Another judge in Washington state has declared that the FDA cannot stop the distribution of this medication, while an appeals court has now left some of the Texas's order in place with a lot of restrictions, but has not completely banned its availability. This is all going to the Supreme Court. Let's talk about it. Hey everybody, it's Dr. David. Now, between 61 and 85% of Americans, depending on which poll you look at, believe that abortion should be legal in some or most instances. Now, this is the most strongest support for this question in the history of polling for this particular question. Now, as I've discussed before, I am first and foremost of the belief in medical freedom and a person's ability to make a decision for their own body, and that the government really shouldn't have much of a say in any of that. Okay? Now, I've also shared that I have extreme sympathy for people who believes that life begins at conception or at the first heartbeat. But I also realize many people do not believe that. And a lot of people believe that life doesn't start until the first breath of life. Now, a fair question to be asked is, should medical medical decision-making be based upon morals and values of a particular group, or should the science allow itself to play forth when a physician, and in this case a woman, is making a particular decision about the health of the individual? Okay, so the issue that is at hand is that this pill, which is the most commonly pilled, called Mifepristone, this was something that was approved back in 2023, in 2020, so 23 years ago. There had been some changes at the FDA over the years, such as allowing it to be prescribed by via telehealth or by non-physician providers like nurse practitioners or PAs. And that's kind of part of what's being contested, as well as the legality of the whole thing. Now, this medication has been allowed up until 10 weeks of gestation, which means 8 weeks into the pregnancy, since the first 2 weeks of pregnancy, that starts at the period, so you're not really pregnant for the first 2 weeks. Now, this medication is also frequently used for miscarriages that may not pass on their own, in order to help expel the miscarriage tissue. But these are both done in order to avoid a surgical procedure, a surgical abortion, or a surgical DNC, in order to remove the tissue that is no longer viable. Okay, now, to terminate the pregnancy, so this medication called Mifepristone, it blocks progesterone. Progesterone is needed for the continue to blood flow, the growth, the lining of the uterus and the placenta. Without it being there, then the fetus is no longer going to get the nutrition, oxygen, etc. And that's what terminates the pregnancy. A second medication is also given called Mifepristone, and that makes the cervix open up and the uterus to contract in order to expel the tissue. Now, the concern that was put forth by this judge, as by the plaintiffs themselves, was over safety. And we're going to talk about the safety of this medication in the first place, but also about the way that the FDA approval process went through. Now, the appeals court, what they did is they left the hold for that the Texas judge, in terms of the overall, they held that up. Okay, there's a hold on the actual 2000 FDA approval itself. So as of right now, it is not illegal to use. It is still available. However, what the appeals court did leave in place was all of the changes that's happened since 2000, such as, and again, we've evolved as medical society, no longer allowing for telehealth or telephone call, no longer allowing for non-physicians to place the order, and no longer allowing it to be done by mail. Now, of course, this will significantly restrict the ability of a woman to have autonomy over her own body, because especially in rural areas, or maybe because of availability, people can't necessarily get to their doctor right away in a timely fashion. Okay. Or there may not be a pharmacy that's nearby that they can get to, or because they have to work to, or because they don't have transportation. And of course, legal in our country is the mailing of medications and of telehealth. So they're doing the particular carve out that's not permitting it for this. Okay. Now, in addition to that, it's also quite problematic because the doctor would then have to see the patient 3 different times as opposed to just once, which is what the current regulations say. Now, this is going to be, again, access, especially if it's far away, that now a woman's going to have to go to a clinic 3 different times, take off work 3 different times if she works, to have to find childcare for a child 3 different times if that is needed. All of these are barriers to access to healthcare. Okay, so of course, with all of this, this is being rushed by the Attorney General to the Supreme Court in order to put a hold on this whole thing while it more plays out. But I am not a lawyer, and so I'm not going to get into all of the legal mumbo jumbo what's going on. But there does appear to be a significant error in what the appeals court has done, and I'm going to quote Supreme Court Justice, conservative Justice Samuel Alito, because in 2020, in a dissent, he wrote about what was happening, that judges took it upon themselves to overrule the FDA on a question of drug safety, and this is not allowed. Okay, these are judges who do not have any experience reading medical literature, understanding data, understanding the science, the way that the FDA does, the way that the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the AMA, all of the medical groups, the mainstream medical groups in our country, believe that this is a safe and effective medication. So let's talk about that. Let's talk about the safety itself. Now, this medication, as I said, it was approved back in 2000. It was actually been used in Europe since 1988. And the FDA data has shown that this is actually one of the safest medications, has one of the lowest death rates of any medication that's out there. And what they found is that there were 5 deaths associated with the medication, the Mifepristone, used by every 1 million people in America who have used the drug since it was approved. That is a death rate of 0.0005%. Now, as a point of reference, penicillin has 20 deaths per million. That itself is a 4-fold increase, a 4-fold death rate compared to this abortion medication. The erection pill Viagra has 49 deaths per million. That's over 12 times more deadly than this medication. So a boner pill used for male satisfaction, more so than a woman's ability to dictate how her life goes. Okay. Now, what about the effectiveness of this medication? Now, when the 2 medications are used together, they are successful 95% of the time. Now, the Mifepristone, the other medication, can be used as a single treatment, but it's only available 80% of the time, and it has a lot more side effects when it's given alone. Now, that means that 15% of people who would take a medication, if it's just the one, would then have to go on to have a surgical procedure because of the failure of the combination of the single use. So this obviously is a very significant difference. So now we have a judge who is blocking nearly 25 years of FDA approval for a medication that's been proven to be safe. And this is causing chaos, but more importantly, this is restricting people from following their own medical decisions. Okay. Now, of course, there's going to be a lot more going on over the next days and weeks. I will give an update as things go along, but I would like to hear your thoughts about this. Do you think that this is the right thing to do? Do you think that women should be allowed to choose how she treats herself and not have to go on to a more dangerous procedure? So let us know in the comment section. But remember, you got to keep it kind. You got to keep it respectful. Have a nice day.